Hello and welcome for today's episode. My name is Dr. Orora Maranga from the Janis Hospital, Nairobi. I'm a consultant gynecologist and also a cancer specialist. Today I want to talk about a very essential aspect of women's health, and that is breast self-examination. This is very important. It's important for every woman to know how to examine their breasts and to do it very regularly because early detection saves lives. And today we're going to look at how to do self-breast examination and what is normal, what is abnormal. Welcome to the show. Now, how does one know that there's a problem with the breast? And that is why we are here about breast self-examination. You can actually, it's advised that as a woman you do it at least once a month, especially after the periods. It's usually the better aspect because by that time then you don't have the symptoms which would usually come with the menstrual flow. And it's important that you can actually either examine yourself when you're lying down in bed or standing in front of your mirror or even seated, whichever position really you prefer. And how do you do it? How do you do that breast examination? Now, in front of your mirror, you could raise your hands. You basically use your eyes and also use your hands, your palms, as it were. And you know about, there's no one who knows better about your breasts apart from yourself. You know how they always are. So in front of the mirror, of course, without your bra, then you're able to look at how those breasts are, the normal position. And then after that, just raise your hands up the way I'm trying to raise up my hands. You know how your breasts would usually move upwards. Usually they should move upwards the usual way. But if you notice that they are not moving, or one breast is not moving as well as before, or it is lagging behind the other one, then probably there might be an issue. So that is one aspect. And that is just looking at it. Look at the skin color. Has it changed in any way, depending, of course, on your complexure? If there is an issue, most of the time it will be like there is some skin color change. And for those who are a bit lighter, you'll find that the skin is becoming like an orange color, so to speak. But that skin color change is important. And apart from that, look also whether the contours are okay. Look at the nipple. How is the nipple? Is it the normal shape, the normal size, the normal position, or has it changed? Is it retracted? Is it becoming shorter compared to the other or the usual way that you usually know your own nipples? And apart from that, then you can now go and use your palms. And generally we would advise that the right hand is going to examine the left breast and vice versa. So I'm going to demonstrate to you, but I'm sure you'll do it better for good reasons, of course, you know. So if you're examining the left breast, then put your hand like this. And usually we assume that your breast around the nipples has 4 quadrants, like you align like this and a vertical line like that. And the nipple being the center of the clock. So we go anti-clockwise. So you can start from any quadrant. Sometimes you may have to start from the lower inner quadrant, and then you palpate using the palm of your hand flat. Relax about it, and then you start going round up to the muscles below it, then gently go to the other one towards the armpit, then go up a bit. That's the outer lower, the outer upper quadrant. and then finish off with this other quadrant here. And don't forget the middle part where the nipple is. That area also palpate or feel it and get used to that. And as you finish, don't forget two things. It's the nipple and also the armpit, or what we call the axilla, and also examine the armpit and examine it in such a way that you can feel if there is any abnormality there in terms of swellings, in terms of lump. But of course, we always have lymph nodes there, especially if you have been hurt or had some infections, you may have some lymph nodes there. So the issue is for you to know whether this is normal or abnormal. Has it been there, or it's a new thing? And especially if it's a new thing, that should be a red flag. And then of course come to the nipple and then press the nipple, press it gently and see if there's anything coming out from the nipple. Usually there might be some liquid which comes out that is like watery discharge. That one is normal most of the time. And most women may have it at some point during their menstrual cycle. But what is abnormal is if you find that there is a discharge which is foul smelling, which looks like pus. And what is even more worrying is if you see blood. If there's any bloody discharge coming out of the nipple, then that is a red flag. It doesn't confirm that you have anything which is cancerous, but it is a telltale sign which should bring some urgency for you to go and see your doctor. So for the other breast, the right breast, it is also the same. You raise this and you repeat the same process like we have just talked before. So that is how you should actually examine your breast, whether you're lying down or a combination of whether you are standing in front of the mirror. Remember, these are very basic ways of examining oneself, but then they are very, very important, because by knowing your breast and knowing how to examine it, then as your own doctor, because you know your body best than anybody else, then you're able to know that I need to see a doctor or I'm okay for that particular matter. So make it a habit, at least once a month, after your period, anytime, create time for yourself. Self-care is extremely, extremely important. A number of times when you see patients coming to hospital, at least in our setup, unfortunately it's a bit late, whereby somebody has probably seen some changes and actually seen those changes. The skin has changed, there's even an ulcer, there's a big lump there. And then it takes a lot of time to even disclose to maybe the partner or to the sister or to any significant person in their lives. And takes time really to come to hospital. So by the time, a number of times when some women come, it's a bit late. And then we have to, the patient has to go through a lot of examinations, a lot of other invasive procedures like removing the lump or removing the breast, or a patient having to go for chemotherapy, that's injections to treat the cancer, or going for radiotherapy and such like type of things. So those are the things. So at some point, we are going to talk about those other treatments, but today our focus was really on how to breast self-examine yourself so that we can avoid those are the extremities. And if there's anything, of course, it is noted early, and that saves lives. This is Dr. Orora Maranga, your specialist, and we wish to encourage you to subscribe if you think today's show was important and is useful and you would wish other people to hear about it. Kindly subscribe and share. See you next time.